Tánaiste, I wish this morning to ask you about the HSE Outpatient Waiting List Initiative, introduced at the end of 2013, in which patients who were waiting more than 12 months were referred from public hospitals to private hospitals for outpatient consultant appointments and treatment. I would like to ask you, Tánaiste, the current situation today with regards to the treatment of these patients. It has come to my attention that in recent weeks, Tánaiste, many of these patients have been told that they will no longer be able to continue their treatment under their current consultant, and that their files have to be returned so that they can rejoin the ever-increasing outpatient waiting lists at their original hospital. To give an example, Tánaiste, a young mother who I'll call Caroline was referred by her GP in January 2012 to Letterkenny General Hospital for an outpatient appointment with a consultant gynaecologist. 2 years later, in January 2014, she was referred under the HSE Outpatient Waiting List Initiative to a private hospital for that consultant appointment, and she attended that in March of last year, at which the consultant diagnosed her as requiring surgery. Caroline, Tánaiste, has been waiting for follow-up treatment from then until last week, when she received a letter informing her, and I'll quote what she was told. "Unfortunately, we have been instructed by Letterkenny General Hospital that your treatment can no longer continue with us due to financial constraints. We have therefore to return your file for your ongoing treatment to be carried out within the public sector. We would like to apologise for this, however it is completely out of our control. If you feel you would like to continue your treatment with us, you can do so privately, and we can provide you with a costing for this." 3 years after her initial referral, Tánaiste, Caroline is now being added back to the waiting list from which she was initially referred. I know that there are 1,300 patients in the same situation as Caroline in relation to Letterkenny General Hospital alone, unable to have their treatment completed as planned, being added back to an ever-increasing waiting list from which they were previously removed. My question to you, Tánaiste, is how many patients are in this situation nationally, and will this government make the decision to provide the funding required to allow them to complete their treatment rather than send them back and add them to an ever-increasing waiting list in our public hospitals?
Tánaiste.
Thank you, Deputy, for raising the issue. The details of the case that you raise, obviously, I'm not aware of those. And in relation to the detail of Caroline, I think you said her name was, I assume that you would want to make a detailed representation on the specifics of that case to the Minister. I wouldn't be in a position to respond to that here now. In relation to waiting lists, the Government is committed to reducing numbers on waiting lists for scheduled care, concentrating particularly on people who are described as being a long time waiting, that is over 18 months, so this lady would fall into that category. The Minister for Health has asked the HSE to develop an action plan for waiting lists, concentrating on those people waiting more than 18 months. This plan is to build on work which is already underway, and it will be available in a number of weeks' time. Also, the HSE has committed in the 2015 service plan to the publication of a waiting list of consultants and at specialist level, and aims to reduce waiting lists by way of redesigning the processes and the way the applications are treated. So the HSE has already put in place specific measures to address waiting lists more efficiently in collaboration with acute hospitals, the Special Delivery Unit and the NTPF. These include observation of the National Waiting List Protocol, adherence to clinical programme guidelines, and prioritising day of surgery admission where that's clinically appropriate. And on elective surgery, the HSE will work on implementing the recommendations of the CNAG report on day surgery in consultation with the National Clinical Programme for Surgery, with specific references to targeting increases in day surgery rates in line with best international practice. And the waiting list performance will be assessed within the revised accountability framework for the HSE, which is published as part of the service plan. And new patient care pathways, such as medical assessment, minor and local injury units and urgent care centres, as well as provision of care in non-hospital settings, are increasingly used to provide, if you like, a spectrum of care which supports the efficient use of hospital resources. So, as I said, I'm not in a position to comment on the details of the lady's case. The Minister for Health, by way of a direct query, would deal with a specific case. But while I'm happy that I'm not happy that we're not meeting all of the targets, but it does mean that 3 out of 4 people are receiving treatment within the target time, and there's a significant investment going into the development of better practices, so that, as I said, in particular, anyone like the lady you referenced who's waiting over 18 months is dealt with.
Thank you. Deputy Charlie McConalogue.
Tánaiste, I'm afraid you didn't answer any of the questions I put to you. I didn't ask you about your future plans, although they're important. I asked you specifically in relation to the HSE outpatient waiting list initiative, a previous plan of your government, which was introduced at the end of December 2013, and in which I've no doubt thousands of people across this country were removed from hospital waiting lists, Tánaiste, to massage them and make them look good, and were referred to private hospitals with the intention, and what they were told at the time was that their treatment would be continued and completed there. Caroline is but one person, and an example, as I say, of 1,300 who are in the same position as her in relation to one hospital in this country alone. I am asking you this morning, Tánaiste, how many are in her situation nationally? I have already made representations in relation to her, as indeed thousands others. And I've taken this up with the Minister, the Minister for Health, and in response to a parliamentary question last week, which he referred back to the HSE, Tánaiste, the answer I got was this: it was our intention that these patients would receive their treatment in a timely fashion in the hospital to which they were referred. The funding required for us to proceed with this plan was not provided, and therefore we are now taking the steps to add these patients back to the public waiting list for ongoing management and treatment.
Thank you, Deputy.
We are currently in the process of communicating with these patients to provide them accordingly. That's what I'm asking you for an explanation of this morning, Tánaiste. I'm saying there's 1,300 in Donegal. I have no doubt that in the street up from yours, there's a patient and many patients in your neighbourhood in the same situation. Are you aware of this case, of this situation, Tánaiste? Can you tell us how many people are in this situation where they are now, their files being referred back? And will you, Tánaiste, commit to provide the treatment that these patients, or the funding these patients were told would be available to complete their treatment under the consultant who's currently treating them?
Thank you.
Thank you.
Tánaiste.
Well, in terms of the details of the cases, you're already in discussion with the Minister for Health. I don't have the details of all of the numbers which would be available to the Minister for Health, and as I've said, I think you should continue to discuss it with the Minister for Health, who has those details. In relation, though, in relation to the numbers, the inpatient and day case waiting list at the end of November 2014 was 61,000, of which 12,500 have exceeded the target time wait of 8 months for a procedure, and over 2,000 children have exceeded the target paediatric wait time of 20 weeks for a procedure. Now, as I said, 3 out of 4 people receive treatment within the target times. That's not satisfactory, and it's the job of the Minister for Health to actually improve that. In November 2014, the number of patients waiting in excess of 12 months for an outpatient appointment is 55,000, over 55,000. And again, while I wouldn't be satisfied with that, it does mean that approximately 85% of outpatients were waiting under 12 months. So up to the end of November, there's been a 3% increase in outpatient attendances compared to 2013. That's 97,000 more patients, 98,000 more patients seen compared with the previous year. So the reality in relation to the health services is they're actually seeing more people, and that very significant numbers, the vast majority of people, are being seen. But I acknowledge what you're saying, that for anybody waiting for a long period, it's stressful, it's distressing, and changes in their care treatment or pattern may be very difficult for them. And I'll take that up directly with the Minister for Health on your behalf.